You've heard of music therapy, but do you really know what it is? Do you know what it means in Pennsylvania and how students can access it? Well, you're going to find out on today's PMEA's Take Note podcast. Well, hello, everybody. I'm Mark Espadakis. Welcome to this edition of PMEA's Take Note podcast. Today, we're dissecting a topic that you have probably heard about being in the music education space. You may have heard about as part of PMEA's Policy Ask, music therapy. So what is it? What do you need to know about as a music educator? What's happening in Pennsylvania related to it? So we're going to dissect all of that and likely more today. So I'm delighted to bring in some folks who have really been working on this in Pennsylvania. And let me introduce them. Nicole, Hahna, Madison, Frank. Thanks for being with us, both of you.
Thanks so much.
So yes, let's just start off. I like to level set. And it's easier for you to tell people about yourself than it is me, because I think you probably know yourselves better than I do. So Nicole, just tell us a little about yourself.
Sure. My name is Nicole Hahna. I am the co-chair of the Music Therapy Task Force, along with my amazing colleague who you're about to hear from, Madison. And what we do for that is we advocate for music therapy across Pennsylvania, making sure consumers and clients can access services. In addition to that, I coordinate the undergraduate music therapy program at Slippery Rock University.
All right, Madison?
Yes. As Nicole said, I am a co-chair along with Nicole. Wouldn't want to do it with anybody else. Of the Pennsylvania State Task Force for Music Therapy. I'm a board certified music therapist in Philadelphia. And I work with neurodivergent children, teens, and adults across a variety of settings in music therapy. And I am the Mid-Atlantic region of the American Music Therapy Association Government Relations Elect.
I like that we have both sides of the state covered here, so we're good. So let's along this theme of level setting here. For folks who might not be aware of like what music therapy is, or just hear this and don't know what it is, I mean, let's truly level set here. Tell us what music therapy is. What is the training? What is the work environment? What do music therapists do?
Music therapy is a healthcare profession. So maybe I'll compare it to music education, since our listeners will be music educators, or maybe music educators in training. So in music education, you are learning music, performing music in order to teach other people how to do the same thing at various levels, from pre-K through 12. And in music therapy, we are learning about music and using music, not necessarily to teach people, but to support people in different areas. So we might be working with someone who has dementia, who's experienced a stroke in a nursing home. So in that case, we're using music not to teach them how to play the clarinet or the drum, but we might be using songs to help them sing their name when they can't speak their name. We also work, sometimes we say cradle to grave. So we work with premature infants in the NICU all the way to at end of life in hospice and palliative care. So we're sort of the healthcare side, where music ed, I think right now there's so many jobs in what I call eds and meds, in the education space. And then in the medical and healthcare space, we're like the healthcare facing side of what many music educators would do.
So talk to me about this, how do you become a music therapist? What's the educational landscape as it relates to getting this point? And let's kind of particularly hone in on what that means in Pennsylvania.
It's similar to music education. You do have to apply and audition for a program, either in a department of music or a school of music. So you would audition on 2 pieces, and you would have to take all of the music theory, music skills, music history, all of the same things that a music education major would take. The difference becomes probably junior and senior year, where music educators might now be taking methods courses and you're learning how to sing and play all of the instruments and then how to teach them and doing field work. In music therapy, we're specializing in specific instruments. So piano, guitar, voice, and percussion are the 4 main instruments that we work on. Sometimes you'll hear us use the term functional. So we'll use functional music with different clients, or the word practical comes to mind as well. So thinking about ways to support someone if they really like the Doors, we're going to find a way to help them recreate that sound, but not necessarily on concert instruments. So we're not bringing out the timpani, but we might use a djembe or a hand drum at bedside. And that's simply due to we don't have a classroom space. So we might be at bedside in a hospital. So it's a 4-year degree for an undergraduate student, and that includes 1,200 clinical hours. So that's both pre-internship and during internship. When you've successfully completed your 4-year degree in music therapy and your 6-month internship, you can sit for our national board certification exam through CBMT, and that gives a credential MTBC, or Music Therapist Board Certified. You can, just like in music ed, go on beyond that. So you can have a master's in music therapy. Madison has a lovely MMT. You can get your PhD in either music therapy or a related field.
So let's talk about how this relates then in Pennsylvania. Are there job opportunities here? Are we seeing students leave? Like, what is and I know this kind of plays into the policy aspect, like tell us about that part of the job force.
Yeah, it's very exciting, actually. Pennsylvania hosts the largest number of universities with music therapy programs in the nation, with 10 collegiate programs. And as Nicole said, including, bachelor, master's, PhD level. But unfortunately, we are seeing the number of students graduating, leaving the state, and it's kind of increasing more so over time. And part of that has to do with the states surrounding Pennsylvania having a music therapy license. So folks from all over the US, and especially in these surrounding states, are coming to Pennsylvania, or they're born and raised in Pennsylvania and they're going to these institutions. They're getting a degree in music therapy, and then they're leaving to practice in other states that have licensure. We've even seen upwards of 100% of a graduating class leave to go to another state to practice. And, licensed music therapists, about 80% of the licensed music therapists in Maryland were educated in Pennsylvania, and also very high percentages of New Jersey and Ohio as well. So we are seeing folks leave for opportunities in those states due to the license.
What a strange paradigm that we have that so many graduating here, so many programs, and then we have this licensure issue in Pennsylvania. It's crazy actually to me, and that's probably like a separate conversation of how in the world did we ever get to that point. But we won't go into that today. But let's talk a little about the licensure. So what is the barrier here in Pennsylvania that is creating this situation?
Yeah, so one of the things that we are seeing and why we're seeking music therapy licensure is to increase access to services, right? So eliminating the barrier, one barrier of it being, practitioners leaving the state to work elsewhere. It's not because there aren't folks in Pennsylvania who would benefit or who would like music therapy services. In fact, we have plenty of private practice owners throughout the state who have very large wait lists. And we have facilities that would like to hire a music therapist, but facility policies require a license. And so we're finding that there is a high need, and then folks are leaving to practice other places. And so one of the things that we know is, for example, from county to county, how services are provided or reimbursed can change. So we can be neighbors and I can access services, but my neighbor cannot access services. And so that's, that's a barrier for folks to be able to get services. The requirement to, go somewhere, or somebody moves and they lose access to services. We've gotten reports of that as well. The other aspect of working towards a license is to protect the consumers and the citizens of Pennsylvania. So making sure that there is somewhere that they can report, or that they can go online and make sure that they're getting a credentialed and qualified professional. And if there are issues that come up, that there is a place for them to go and share those ethical concerns or report that information, and something will be done to protect them in that way. So those are our aims in music therapy licensure, is to increase that access and to ensure protection for our consumers. Nicole and I have been on the task force for a long time as completely volunteer, and we've been working hard. I think some of the barriers initially were simply educating what music therapy is, right? There are a lot of folks that weren't sure what it was, hadn't ever heard of it. And so before moving all the way to maybe regulating a profession or talking about making changes to the law and having bills passed, well, we need to understand what this profession is. So that initially was a barrier, was education, I think.
So let me jump in. Let me just, and I'll let you go in a second. I just want to go back to one of your points. You said like one of the barriers here is like a facility might say, okay, we don't want to hire somebody because it's, or maybe not want to, it's we can't because of policy. I'm curious, like, does insurance play into this? Like, is that an issue, like for licensure, that maybe an insurance company is willing to cover something or not, or am I off base on that?
Yeah, so the application to become a provider with an insurance company will typically have a space where you have to list your license. So currently, many music therapists can't even apply depending on what county you're in. So that's one of those barriers, that if you can't become a provider, it then means a client has to privately pay. So having a license of music therapy in Pennsylvania would potentially help increase access to music therapy services. Yeah, it's an unfortunate barrier. Sometimes we think about regulation as being red tape, but in this case, actually licensing the profession of music therapy would reduce red tape. So in order to help increase anyone, no matter what county you live in, having one single rule about who is a qualified provider would help. And I wanted to just touch base on what Madison was saying as she was highlighting the brain drain. I want to be clear that there are so many jobs in music therapy. The U.S. Department of Labor has identified music therapy as a bright outlook profession, meaning that we are going to have higher than average for a typical career over the next 10 years of need of jobs. And so we're creating this almost like perfect storm in PA, where we're graduating the most people and there are jobs, but because of those red tape things of not being able to apply for some of those jobs in PA, they're going to, I'm like 30 minutes from Ohio. Ohio has a licensed professional music therapy. So many, not all, but many of my grads are just driving 30 miles down the road and then working in Ohio. And for many of Madison's colleagues as well, living in the Philly area, crossing the bridge over to New Jersey where they have a license. So that's where we're seeing some of those instances of brain drain. And we're hoping that a license in Pennsylvania music therapists could help keep those grads that we, I think, really do a great job of educating, keep them here and keeping some of that homegrown talent, musical talent, and just great clinical expertise here in the Commonwealth.
So this all makes complete sense, and this seems like this should be an easy thing to do, but we know that that is not how government and politics and all of that works. But what's the issue here? What is the hang up to make this happen? We have other therapy areas that are licensed in the state. What's the issue here?
Well, we currently have in both the House and the Senate mirror bills that are with the licensure committees. So we are simply waiting for a vote in those committees. We have tremendous bipartisan support on both sides of the aisle. Music therapy, just like music education, as you know, Mark, it's not a political issue. Access to music should be for all, both in education and in the healthcare setting. But we are waiting for a vote in both the House and the Senate licensure committees.
And I know you both are regularly in Harrisburg advocating for this. Yeah.
And we think PMEA, Music in the Schools, we so appreciate the advocacy efforts that you and all of your team has done, Mark, for both music education and music therapy, truly.
Yeah,
Yes.
I think Madison, you were gonna.
Yeah, and I'll just say what our bills are. We have House Bill 563, which is sponsored by Representative Eddie Day Pashinsky, who music educator.
Yep.
There are no music therapists without music educators, right? We learn how to play our instruments, we learn how to sing, we learn how to, be in ensembles and teamwork and, working together. There isn't music therapy without the work of music educators. So yes, I reiterate what Nicole says with that importance. And it was also lovely to be in Harrisburg and hear beautiful music and from, young folks across the state performing in the Capitol. It's beautiful. And then our Senate bill is Senate Bill 579, which is sponsored by Senator Elder Vogel and co-prime sponsored with Senator Carolyn Comita. Yeah.
So, okay. Like it's there, it's in the works. We know that it's, government works the way government works. What can people do to help push this along? If we have music educators out there say, like, okay, we're sold. How can they help the process here?
We have a voter voice, which we'd be happy to give you the link to, Mark. Maybe you could add that to the show notes, where either a music educator could reach out directly, or you could use one of our pre-formulated templates just to let your representatives know that you support the licensing of music therapy as a profession. And with that, it would give recognition to our credential. It would protect consumers. It would allow for so many of the consumers. Right now, we have about 49,000 PA citizens that are receiving music therapy, and we expect that number to tremendously increase once we have licensure. So yeah, they could fill out our voter voice. And if that's something they didn't want to do, they could simply email. A great website is PA Who Represents Me. I like to just Google that. You can type in your address and just send an email. I support music therapy licensure, and it gives you everything you need to move forward.
So pulling it out just a little bit, like let's kind of go back to the general topic of music therapy. So there's so much talk in education now about workforce readiness, career standards. I mean, we have career benchmarks in Pennsylvania for students. And so I think music educators now are more than ever thinking about, where different careers in music. Because not every student, as I always say, is going to be the first chair clarinet player at Carnegie Hall, right? And like that's not, nor do they want to be. Like it's about music for life and being engaged citizens and being engaged in something. But we talk so much in the career space about, if you can have a love for music, but you don't necessarily have to work in a job that is always performing music. We talk about you can be an accountant at a manufacturer or any number of those pieces of the puzzle. Here's another career piece that I'm thinking that maybe folks are not thinking about. So I'm going to give you the chance here, like give the pitch for what, why students, for the music educators listening, why they might want to pitch to their students. Here's another great career option. I mean, floor is yours for a pitch on that.
Yeah, maybe I'll share a little pitch. And Madison, do you want to give like a day in the life of a music therapist? That might be really exciting for some potential students. But anyone who has a love of music, which is going to be so many of our music students in our pre-K through 12 music education programs, anyone who has a love of music is thinking about majoring in music and also wants to use music to help people. I think that's a really great, like the Venn diagram of that is a beautiful place where music therapy fits in. about 20% of music therapists are going to end up working somewhere in the medical setting. So if you kind of see yourself like, oh, I'd love to be a nurse, a social worker, but I'm not really sure I want to, draw blood, and I don't want to give up playing French horn or bassoon. If you can start to see yourself like wanting to work in a group home, a nursing home, if you're interested in education, music therapists tend to work in special education or with diverse learners. So maybe you see yourself in a school, but the idea of conducting a choir, orchestra, marching band, or doing general music, it's not quite what you were thinking about. You can use music in the education setting as a music therapist to support diverse learners through their IEPs and their 504 plans. So more of life skills, academic concepts. So my pitch for why to be a music therapist would be, or if it would be a good fit, is if you have a love of music, you'd like to major in it, and you'd like to work in the healthcare setting or in the social services setting, I think that makes a really great candidate for music therapy. Right now, like the timing of becoming a music therapist, there are more jobs than graduates, which is a great problem to have as a career. Right now, we're hoping that licensure can keep more of those jobs here in PA. But with baby boomers aging, we are expecting our healthcare systems to have an increased need. So right now, studying music therapy, I would say this would be an ideal time to take your love of music, your passion for helping others, and combine those into a 30-year career path.
All right, Madison, give us a day in the life here.
Yeah. A day in which music therapist's life is also really
okay.
a really key thing, right? Because as Nicole mentioned previously, we are a cradle, it's called a cradle to grave profession, right? So we can work, with expecting folks through birth, NICU, all the way to actively dying and in hospice. And nobody has, a client or a patient of music therapy doesn't have to have any musical skill or background or anything like that. So if we're thinking in terms of maybe music therapy in schools or IEPs, music therapists might show up at the school district that they work at, have a team meeting about different students, and then having individual or group music therapy sessions working with individuals on IEP goals. So they might start their morning with a little team meeting, and then they'll go and they'll hang out with an 18-year-old who's getting ready to transition into an 18 to 22 program and work on job skill training skills. We'll work on joint attention. We'll work on sorting, different things through the use of music. And, part of the IEP goals, document that kind of progress. And then I'll go hop over here and I'll work with two 5-year-olds in a dyad working on turn taking and, learning how to express themselves, not only musically, but maybe working on some speech as well. And then I'll bop over to a middle school and I'll have a group of, 11 or 12-year-olds, and we'll work on coping skills and, handling the stressors of middle school life and identity and trying to figure out what it is I like and, I'm in an awkward phase of my life, and how do I process, find out what my likes and dislikes are? How do I make friends? So it's never the same thing twice. You can work with, large age groups, different type of music, right? Everybody's got their own preference of music, right? You might be singing songs with a preschool class that you weren't expecting to play with a preschool class. I've had many of 5-year-olds who love Metallica. So, you really never know. And that's just one possible music therapist working in a school setting. You might have somebody who works in long-term care or med rehab. So they might do therapeutic instrument music performance where they're using instruments to work on their range of motion, or maybe they had a stroke or they have Parkinson's, and we're gonna work on coping strategies and strengthening muscles, playing instruments, and then might move on to a group where we do memory reminiscence and reality orientation and Then we have lunch and we go and we talk with folks and check in with the nurses or check in with the therapeutic team, which could be rec therapists, physical therapists, OTs, speech. I find in my own clinical work that I do a lot of collaboration and co-treatment with other as part of our, to work with other folks. In school settings as well, I talk with a lot of music educators as well, and we support the students together. And then maybe around 3 or 4 p.m. you have a group or you have a session for someone who might be particularly struggling with disorientation during that sundowning time, and you provide that support there. And then you maybe do individual sessions. So folks I always say, if you're not quite sure what you want to do and you kind of figure it out, you can try a little bit of everything. There's something very unique about our profession in that if you do a fieldwork placement or a practicum in a population that you're not really interested in, there's a million other things. And the skills you learn in your education really prepare you to be a reflexive and adaptable and ready and willing to try other things. And if this isn't what is your fit, it doesn't mean you don't have the skill set to do something else, right? And all gathers on. So that's kind of like two little day in the lives. But if somebody wanted to do independent contractor work or private practice, that could be their day. They could do school and working with older adults. There's so many opportunities and options for folks.
Well, go ahead.
I can do a quick day in the life if you want on the medical setting, because I'm just imagining who might be listening. They might have someone like, oh, well, I have a clarinetist who would really like to work in a hospital. So I worked at a regional hospital. And so my mornings would start with a group on the behavioral health unit. So I might be supporting people who are in recovery from addiction. So doing a group there. And then doing several one-on-ones. I worked in spiritual care. So my boss was a chaplain, and that also meant that I was on the Code Blue team. So at any point, if my pager went off that someone was experiencing difficulties, I would immediately come and help support either the staff or the patient and their family. So I might start with a group on behavioral health, and then I do a couple one-on-ones. I would often go to the GMU or the general medical unit where someone might be waiting overnight and very anxious about labs. So we would help to do some music-based relaxation. I might then get paged to provide spiritual care support as part of Code Blue. So it might have been a nurse who had difficulty with resuscitations, and so giving her some supports. We also would do a blessing of the hands of surgeons in the morning. It was optional for surgeons, but if they had a particularly difficult case that they were about to go into, we would provide some opportunities for them to connect spiritually before going in. I would then probably have lunch, go into an oncology unit. That tends to be one-on-ones. So helping to support people with their cares of plans. Sometimes you might be on hospice or palliative care, but you might still choose to receive things like chemo for the management of the size of the tumor. So making some of those large decisions through things like songwriting about, do I want to go through the most aggressive treatment, a moderate treatment, and it can be very difficult when you have chemo brain to sort of make all those decisions. So providing supports for someone to sit through some of those really life-changing choices about how many surgeries should I do, surgery, chemo and radiation, just chemo, just radiation, all those types of things. And my day might end by going on the peds unit, where we would often do a lot of procedural support. So a child might be afraid of needles, and so they might need to get an IV. And so I might do some music-based redirection so that the nursing staff can put in that IV, can get those really essential medications for them so they don't have to be sedated. So we can come in a non-pharmacological way to help provide supports. But I hope that sometimes giving that day in the life can give a little bit more of a picture. I like to kind of imagine as if we've all seen music education, because as Madison said, we wouldn't be here without a music educator. You can't even study music, let alone become a music therapist, if you don't yourself know what that's like. But yeah.
Well, I have to say, this has been absolutely fascinating to take the deep dive to understand it a little more. And I hope folks understand it a bit more, but also the value of licensure. We will put that link out there for sure, so that folks can go and, prod Pennsylvania's legislature a little bit to see if we can make this happen. So Nicole and Madison, thank you for taking the time to be with us today.
Thanks, Mark.
And thank you all for being with us on this edition of PMEA's Take Note podcast. We will see you next time.